Good afternoon, everyone. It is 2 p.m. Welcome to Cook County Health Department School Health Update. I am Kelly Jones. I am a senior health educator with Cook County Health Department and your moderator for these meetings. Forgive me for staying off camera. I've been under the weather all week, but I'm going to persevere for this meeting. Let's get started. We have a few updates for you. As usual, our objectives are to share updates, information, and resources to help schools navigate school health issues, answer any frequently asked questions, and provide CCDPH contact information and resources. All of our webinars are recorded and they are uploaded onto CCDPH's website as well as our YouTube page. Please keep your line muted. We don't want to interrupt, and we want everyone to be able to hear everything that our presenters have to offer. And please make sure that you are entering the correct email address, as I get a lot of return emails when I send out information. I want to make sure that everyone is getting the information that we have put together. Appreciate it. Our agenda for today is we have some announcements and some resources, a few updates. We have an address from CCDPH's new Director of Public Health Administration, Ms. Marley Hendricks. We have a naloxone update from Denise Holman. I'm sure you guys have a lot of questions about the program. I get a few questions. And we have some behavioral health partners who will come on and talk to you about their programs and share additional community resources. Our communicable disease department does not have an update for you, but Michelle is on and Tarek is on. If there are any questions that need to be answered, you can put those in the chat. Couple announcements. The in-home vaccination program, the destination vaccine program where you could get a ride to your vaccination, and the mobile vaccination clinics are all ending in December. The last day to request a mobile vaccination clinic is December 8th. So that's further down in the slides, and the date is printed on those slides that I usually share. So if your organization is trying to get a mobile vaccination clinic, please keep in mind that that last date is December 8th, and those in-home resources are ending as well. If you need to contact CCDPH about any webinar-related questions or any general questions, you can use the Healthy Cook email. If you need to contact communicable disease and report line list, report communicable diseases, any metrics questions, you can send it to their CCDPH_schools email and our general Cook County Health Department website, as well as the school-specific and vaccine website. And if you send anything to vaccine preventable diseases that's meant for me, they'll send it to me and vice versa. So we share the information with one another to make sure. And here is our Cook County Health Department calendar. And there are still some vaccination events and some community outreach events going on. And you can find all those events on our calendar. There's a vaccination event coming up this weekend. EpiPen and albuterol requests. I am a jack of all trades, and I am also the coordinator for the EpiPen and albuterol project. You can send those requests to me, kjones1 at cookcountyhhs.org. I see someone's line unmuted. Give me 1 second. Make sure everyone's muted. Okay, you can send all those requests to me at kjones1 at cookcountyhhs.org. Make sure that those requests come from the school nurse or medical professional who's been trained in administration of medication. And make sure you type those requests and attach those requests. Please don't send any links. I cannot open links. This is what our new documentation of training form is. New this year, in addition to those albuterol and EpiPen request forms, you must send a documentation of training form, which looks like this. And you must list at least 2 employees within your school who's been trained. It could either been trained by your school nurse or an outside entity. And you must list who has been trained to administer this medication in an emergency and submit that with your forms. Here's just some resources for allergy medication training. People have asked me where can I receive those trainings, and I found the resource, and also a resource for EpiPen for Schools, which is a nonprofit program that supplies those EpiPens for free for schools. For schools who would like to participate in the Rescue Illinois program, which has just started. 80% of schools are eligible for the albuterol program, eliminating the need to come to me at Cook County to request those albuterol resources. Not all schools qualify, about 80% do. If you qualify or if you're not sure, you can contact Naomi Soto at Allergy and Asthma Foundation, and she can set you up or tell you about the program. If you find that you do not qualify, you can still send those requests to me, as I'm still getting some requests from some private schools and some other co-ops. Any naloxone requests you can send to Denise Holman. She'll be on the call today to provide some updates about the program. But any requests for those Narcan kits, you can send to Denise Holman, and her information is there. Just a few resources from our communications team about our Boost Up campaign. As you can hear, I don't feel too well. A lot of people aren't feeling well. It's respiratory health season where flu and RSV and COVID are starting to come up in higher cases. So we want to make sure everyone is boosted up. So there's information on how you can go about getting your flu shot, your COVID vaccine, and if needed, your pneumonia and vaccine and other vaccines. So don't wait to vaccinate. These are things that we have in English and Spanish. I love the colors. Purple's my favorite color. Information on how to wear masks. These are older resources, and then some other vaccine resources from other entities such as CDC. And this slide needs to be updated because it's no longer only COVID specific, but it does has good addresses for all of our ACHN clinics through the Cook County Health System. So if you know someone who is uninsured and wants to be a part of the county care system and needs to see a doctor, they could go to any of these locations to set themselves up and seek medical care. As I stated, this in-home program will be ending December 8th, as well as the transportation program. The final day to request a school clinic is December 8th, and I believe the last day for clinics will be the 17th. And that's ending as well. But however, you still can go to covidtest.gov. I know they ended the program at one point, but now they have a surplus. So you can now go online and request more at-home COVID tests. I just did that a few weeks ago. So I realized the ones I had in my cabinet were expired. And every time I get a tickle in my throat, I go to that cabinet and take an at-home COVID test. So you can go and order some. You get about 4 tests per recipient. But if your organization would like large amounts, Cook County Health Department has a surplus of COVID antigen test kits that you can request for your organization. You can send a email or click the link here to request COVID test kits for your organization. We don't want these to expire. We want to make sure that everyone in the organization who can use them can get them. In the community, I'm sorry. And also PPE requests. We still have some hand sanitizer, some masks that we'd like to get out to the community. And if you weren't on our call last month, we had some representatives from mobile vaccination organizations to come out and talk to you guys about how they can still provide those mobile vaccinations for you. And I just listed all of their information, so you can still reach out to them outside of this meeting, as well as the IDPH Wellness on Wheels request form. They can also do some mobile vaccinations in the community as well. Blue Island Neighborhood Network, which is a partner of Cook County Health Department, is sponsoring a food box giveaway. Blue Island Neighborhood Network has already fulfilled their request for families who are in Robbins for food boxes. So this is only for Blue Island.
That contract, right?
So hold on a second. No, she's not. So we're going to mute everybody and we're going to continue. So this is only for Blue Island families only because the Robbins portion that has been allotted has already been filled. But if you know any families who could benefit from this food box, you can email this form and I'll attach the form to everything that I send out next week. You can send this form to Kendrick or to, I believe her name is Hannah, and the information is on the slide. We want to make sure that we get that out to any families who are in need this season. I had some people contact me about the Stop the Bleed program. I wasn't familiar with it. However, I did find some resources on an upcoming Stop the Bleed training. And if you're unfamiliar with Stop the Bleed, it just shows people hands-on things that they can do for first aid in an emergency situation. This is an in-person training. If that time does not work for you, I am having a representative of Stop the Bleed from Loyola Hospital come on to our call next month just to give an overview of the program. She's unable to do a training as it has to be in person, but she can give you all of her contact information and an overview of the program, and you can contact her to set up those trainings with your own organization. Information for mental health services. NAMI Chicago is a partner of Cook County Health Department. You can also make sure you spread information for 988 Suicide Crisis Line. You can text, call, or get online for anyone who is in crisis, and there are people who are able to answer and facilitate that help, as well as 211. We know about 911, we know about 411. 211 is a crisis line, and it's nationwide, and you can call and say, I need housing, I need food, I need a place to live, I need clothing, and all of these partners are in this database and they can help you out with any of these referrals. And again, just like 988, you can call, you can text, or you can go online, and there are people who are able to answer and give you those referrals. Some information on Sir Thomas healthcare, mental health information. Information on the transportation for forest preserves. We talked about this before. If you have a school group that wants to go to the forest preserve for any of their numerous activities they have, but you don't have transportation, part of Cook County's budget is you can call the transportation line and set up that bus to come out and pick up your group for that outing. Here's some free resources for free CPR trainings, and then a link for Cook County Health Department resources. And of course, this will change next month as the vaccine clinics and in-home vaccination and transportation is ending, but it's still good links for in-home tests, free antigen tests, and finding any vaccine locations if you still need help finding information on how to get a COVID test and a COVID vaccine. That is it for me. While I pull up the next set of slides, I would like to introduce Miss Marley Hendricks, who is Cook County Health Department's new Director of Public Health Administration, and she would like to say hello to you guys and spend some time introducing herself. Welcome, Marley.
Thanks, Kelly. Hey, everybody. So real quickly, I was given the honor of attending the call and given an opportunity to introduce myself and offer an opportunity to give me your input, or give me and the agency your input. So I'm just going to spend a little time just saying who I am and what on earth my job entails and what does that mean to you. Next slide, please. And so you guys are gonna get a deck, so this is kind of weird looking at a photo of myself. So just high level, prior to coming here, I've worked in a number of different settings, heavily in healthcare, lots of finance and strategy. And here at the health department, working very closely with frontline staff to build out infrastructure to better enable the way we do work here. Next slide, please. So what does the administration unit do, or what does my team do? So there are 3 units that report to me. So facilities management, workforce development, and our fledgling kind of finance unit. And so what all this means is there's a cycle of kind of liaising between the kind of overall enterprise of Cook County Health with the health department, working on kind of creating kind of the core administrative functions and optimizing core administrative functions. So that would be kind of budget interactions, grant management, kind of financial forecasting, as well as doing kind of core team building for our actual frontline staff, and making sure that folks are trained and have a path to grow. So yeah, everything is really kind of in lockstep with each other. Next slide, please. And so just so you guys get a kind of peek underneath the hood, this is my org structure. My team consists again of these kind of facilities, workforce development, and grants, which includes kind of grants and corporate finance. Next slide, please. And so now what does that mean to you? Because it may feel like, well, why is this lady on the call? So when you think about our strategic plan, which is a published document, 2 of the core pillars of my kind of value add to the organization and to the community at large is what we have circled here. So community partnerships and collaboration, and it's not by accident that it's right next to workforce and workplace. And so a big piece of what I'm leaning really heavily into is enabling our workforce, empowering our workforce to ultimately scale into the community partnerships. And so this will be a multi-year plan. Right now, very much leaning into kind of internal improvements and optimization. But ultimately, this scales to you, my community partners, to our community partners. And so I want to kick off this relationship and make myself accessible to you because the relationship building starts now. And so too does the opportunity to give feedback and ask questions and get to know each other. We can take one more, please. So, taking a step even further, just to get you kind of oriented to some of the work that's already kind of underway. So, this is a slide that was put together to kind of delve into what do we mean when we say workforce development. So just want to call out here about, when I think about my community, I not only think about you, our community partners, but I also think of my community as the staff in this building, the staff across our multiple sites, and making sure that they who are representative of our communities, live throughout Cook County, work throughout Cook County, have what they need to do what they need to do, whether that's working, living, career progression, what have you, kind of holistically. Next slide, please. So here we get a little bit of woo. So, some of that is just kind of understanding like what our shared values are. So these are some of the things that were shared with I have a small advisory group made of frontline staff from across different units, and they're intended to really be the heartbeat of kind of the bedrock of the workforce development work, where they have a direct line to the thoughts, opinions, and aspirations of our various units and teams, and so they have a seat at the table. And so these are some of the values that were discussed and promoted as kind of where we're headed. And then some nice images that show what it is to theoretically be a team that works well together, right? Whether you're a symphony, first responders, or, rowing a boat, it's good to work in lockstep. So this is kind of a deeper dive into what that special kind of advisor group is doing. And so these are kind of the goals associated with that. So we're calling it a brain trust. And that, again, they're a direct line to the staff, and their advice is heeded. So, just calling out what we're doing here. So discuss, assess, and recommend workforce development priorities anchored in staff informed feedback. So this is very much kind of the community-based research model, where we understand that the work is informed by the people who are actually touching our communities, right? And so it's really important that this is not, Marley in a vacuum, just saying this is what we're going to do. And instead, it's me listening and learning and saying, okay, what do you perceive as your needs? And so that input is then going to be used to inform our roadmap, that will actually take the strategic plan and then carry it forward and actually activate it into kind of measurable objectives. And then they're intended to advocate for their teams, so that, ultimately, these practices mean something and are sustainable. Next slide, please. So what does this mean to you? So as I said before, this is some of the example of some of the work that's currently underway, really leaning into the actual workforce here. So it's kind of an internal focus for 24, but for 2025, the intent is to expand that lens outward and to try to do more kind of enablement from our community partners. So what I'm asking, it's a soft ask, is that you consider providing your opinions. So when you think about the relationship that you have between Cook County Health, Cook County Department of Health, what are some ways that you think that we could um, improve upon our relationship, things that we're doing well that we can do more of? And so this is just kind of like a broad kind of opening of hopefully a stream of communication. And who better to think about imagination, right, than kids? So just think about what it is that you need and what it is that you aspire to have, what kind of relationship you imagine that we could have. And if you're willing, I'd love to hear it. Thank you.
Thank you so much, Marley. If anyone has any questions for Marley, feel free to unmute yourself and ask any questions. I know from my experience with the schools, you guys are not shy and you are eager to share your opinions and your experiences. So we'd love to hear it. This is the time. Or if you're feeling shy, you can email Marley as well. We will give it another minute, and then we can go to our next presenter if there are no questions for Marley.
Yes, and my contact information is included in the deck, so don't feel any pressure. You can let that marinate.
Sounds great. I will make sure I share Marley's slide deck with everyone next week when I send out the slides. But I appreciate you taking the time to address our schools, Marley, and in an effort of being more transparent and the schools meeting more people with Cook County Health Department. I appreciate you coming on and then putting a face with the name.
Thanks for having me.
Thank you so much. I'm going to stop sharing and bring up Denise's slides. And while I'm doing that, for those who have not had the pleasure, Denise Holman is a health educator with Cook County Health Department working on the Narcan program and works in our behavioral health department. Welcome, Denise.
Good afternoon, everybody. I hope you all are doing well. So as Kelly stated, and thank you again, Kelly, for this opportunity. I work on our opioid distribution and training program. So I am that you would reach out to when your school or your school district is looking to have naloxone, looking to have someone come and train them. So next slide, please. Okay. So I wanted to give just kind of like a brief background into what I do and why we are so invested at Cook County Department of Public Health and recognizing overdoses, opioid use, and things of that nature. So last year in Cook County, the medical examiner's office has confirmed. So we're still also looking to have 2021's data completed, so just getting even last year's data, this is close we're gonna get, and it could be higher. But they have confirmed 2,000 opioid-related deaths just in that year. Next part. More than 91% of those opioid-related deaths included fentanyl, and just 70% were 70% were in the city of Chicago. So if we think about the fact that we're serving suburban Cook County and they had 30% of those deaths, that's a lot. And also we look at the fact that the state of Illinois had 3,000 opioid related deaths and over 2,000 were here just in our county. That's a huge issue in which we want to combat. Next slide. So, also, I broke down just a little bit from the data from last year as far as those deaths. And I know that a lot of times we're thinking about the children in our schools and the fact that we're hoping and we're wishing, we're praying that we're not having any situations where our students are using, but there are cases. And then also we have to think about the fact that when we're on school property, that there's so many other people that are coming around. We have parents, we have staff, we have visitors, and we don't know the situation. But I just wanted to break down just a little bit. If you saw that teenagers made up about 1% of the opioid related deaths, but we have been seeing situations, especially if you look into the news, about young children who are suffering from overdose deaths. And that's why I wanted to come to you guys today to talk about that. What Cook County Department of Public Health does as far as opioid response is that we train on opioid overdoses, the use of naloxone for community-based organizations, which includes schools and law enforcement agencies. We distribute naloxone drug checking strips, such as fentanyl testing strips and xylazine testing strips. In the nearby future, we will be able to give out benzodiazepine. I can never say that correct, right? But we'll be giving out those test strips pretty soon. We give out technical assistance to establish drug checking, deflection protocols and programs. And we have a data collection of opioid use disorder, and then opioid overdoses to inform public health about these efforts. Next slide, please. The reason why I'm really here today is because we know that a House bill was passed earlier this year, back in July, that will make it that schools from kindergarten through 12th grade are required to have naloxone on their premises. It goes into effect come January 1st of 2024. And I know a lot of schools are wondering, how much would that cost me? Most of the time, if people go outside of like our program, going to a pharmacist, it could be anywhere between $75 to $150 to pick up naloxone. However, our program, we make it where it's free for the schools to pick up. We will also be able to do training for staff to let them know like how to administer naloxone, what to um, look for if they're seeing if someone's overdosing compared to just being high. So we offer those trainings. And one of the things I definitely want to stress is I know that with the schools that I have talked to so far about giving them naloxone, everyone's very concerned about the standing order. When you pick up from us, you do not need a standing order. Also, Cook County Department of Public Health does not offer one at this time. I reached out to the Illinois Department of Public Health to see what was going on, if they could use the standard standing order that's on their website, and would that be sufficient enough? And we know that the Illinois School Board Authority, I forgot what the E stands for, sorry. But they will be coming up with guidelines pretty soon on how to proceed going forward. So right now, we're looking at the fact that no one will need a standing order until ISB makes that final call. So hopefully they should let us know something come mid-December. But if not, I will try to keep you guys as informed as possible. And that's pretty much the end of my presentation. I put my email on here as well as the link to the form that you can fill out to request to have naloxone for your school district. Are there any questions that anyone has?
Thanks, Denise. We appreciate the update. We'll give people a minute if they have any questions they're putting in the chat, or feel free to unmute yourself to ask any questions. I know there are questions as I get them all the time, so now's your chance to ask Denise any questions you may have regarding the program, or you probably answered all the questions and they don't have any more questions, which is even better. So we'll give it another.
So
Oh, here's a question. How can we get our school signed up for the training and supplies?
So through that link, the need naloxone, that's when you make the request for picking up naloxone from us, and also on that request form, you can ask for training.
Thanks for that. Hey, Kim Haynes, I didn't see that you joined. Thank you for joining. Any other questions for Denise before we move on to our behavioral health presenters? I don't believe there are. Thank you so much, Denise, but feel free to hang out if there's any more questions, or you can email Denise directly, or if you lose her information, email me and I'll forward it to Denise, and her slide deck will be sent with our slides later this week. Thank you, Denise.
Thank you.
And while I stop sharing, I would like to welcome Adrian Cardenas, who is from Pillars Community Health. He's a coordinator at the Loft 8 Corners. Thank you, Adrian. Welcome.
Thank you. I'm going to go ahead and share my screen with all of y'all today. Um, so for those who may not know who I am, my name is Adrian Cardenas. I am the Pillars Community Health coordinator for the Loft at 8 Corners. We are a new space in Brookfield, Illinois. We just opened March 13th of this year, so we're about 8 months, if I'm doing the math correctly, new. And with that, it's a whole new program. So we are kind of the first in the state, kind of really the first in the country to have a teen wellness center that is focused on mental health. So eligibility and access. So who we are serving are teens who are entering 9th grade through 12th grade. There has been some kind of opening it up more so to our 7th and 8th graders. But for right now, we are just serving our 9th and 12th graders. We do not have a catchment area of any sorts. So if a teen from Evergreen Park, from all the way in the city of Chicago wants to come and utilize our services, they are more than welcome to do so as well. Um, we do require consent from the team, but also and the guardian and parent. And the reason why I put and in bold and underlined is at the age of 12 in mental health, right, our teens are able to consent to their own mental health services. So with that, we also kind of just want to be that space where we're going to be that one less adult that's forcing them to engage in something. But we also want them to take ownership over their mental health services too at the same time. So if they are wanting and willing to engage with us, and the parent is all right with that, we are more than happy to take them. If they are coming in and they're just like, I don't want to talk to anyone, I don't want to do anything, we will not force them to do so. If they are 17 or 18 years old, they can consent on their own. However, we do encourage parental consent still, so this way the family is getting support as well. We are open 7 days a week. Monday through Friday, we're open from 1 to 8 with our programming starting at about 4 p.m. just because kids are still in school until about 3:30. And then on Saturday and Sundays, we just changed our hours from 1 to 8 to 10 a.m. to 6 p.m. So this not only gives teens some ample time to come earlier in the day, but then they have time to spend with their family and their friends, but then also for our staff as well to kind of have some work-life balance at the same time too. All of our services are completely free. We will not ask them for any insurance, any co-pays, or anything like that. I know for some it sounds too good to be true, but we are a free service. We do welcome walk-ins. We don't really take appointments. They could just walk in to utilize any of our services. And then all of our registrations and consent can also be found online at www.corners.org, or they can come in person as well to fill out that paperwork. I will also mention too that we are a partnership with Pillars Community Health and non-metro suburban. So as I'll kind of go in a second, that's kind of where we form our interprofessional team. So we do have clinicians on site who are there to really do our assessments if need be. And they're all employed by Pillars Community Health. And then we have our recovery support specialists who are all young adults living well in their own mental health recovery who are sharing their own story with the team. So a lot of times when you have a team who's talking to a social worker or a therapist, we as clinicians can't really dive in or express a lot of what we have gone through. So sometimes that can be a barrier with developing rapport, especially with our teens. But sometimes it's a little bit easier when we talk with that recovery support specialist to build that rapport and have someone who really kind of understands a bit more. And they are all employed by now.
You froze for a bit.
GAT2,
Oh, there you are.
PHQ2, and the Columbia Suits at senior year as well. If
I think you're frozen, Adrian.
So
Oh,
if
there you go. I can
anything
hear you now.
were to stick out on that screening like they do when they come in, and then one of our clinicians will go ahead and do a further assessment with them. And it's just a very basic organic conversation.
Are your slides stuck, Adrian? Uh-oh, I think he's gone. Oh, there you are. I'm sorry. Can you hear me
Hi there,
okay?
all. I think my internet here at the loft is a little spotty, so I'm joining you
Okay.
on my phone. So I don't have the slides in front of me, but I
If
can
you
go
give
ahead
me a
and send
second, I
those
can
out to
pull them
Kelly so
up. I
that
see
you
you
all
sent
have
them to me. Are you
something to
okay?
reference as
Okay,
well.
no
Um,
problem.
so kind of just where I left off, we do utilize some evidence-based screening tools. We do utilize the GAT2, the PHQ2, and then the Columbia Suicide Severity Rating Scale. If anything were to stick out that was alarming, one of our clinicians will then do an assessment with them. It's just a basic organic conversation. From there, they can then have a one-on-one with our recovery support specialist, or they can do our groups. And our groups range from psychoeducational to expressive arts to movements such as yoga, um, or topic-specific groups such as our LGBTQ group, anxiety, self-esteem. So we like to really provide an array of groups for them to kind of engage in. And then lastly, we do provide family support. So we do have a family support specialist, and her main job is to provide support to the parents and the families. Um, so a lot of times I am a firm believer that if our teens are the ones working on their mental health and coming in for services, that the parents should be getting support so that they know then how to also support their teen through their mental health. Um, a lot of times we do get questions on if they could come here for therapy, for counseling, or if they could just, come here all day for groups kind of similar to like an IOP or a PHP. We do not substitute any of those services. If they are also in a crisis, we do still encourage them to, utilize 988, call 911, or go to their nearest ER, just because at the moment we do not have that capability of further assessing um, our teens, unfortunately. So with that, we will then go ahead and give them some resources as to where they can utilize this person. I always like to say the loft is a supplement to any other resources that they're getting. So if they're in therapy once a week, we will then encourage them to come to the loft so that they continue to develop those skills at the same time, so that they can put those into their toolbox at the same time. Um, we do have a very nice area as an adult. I like that it is my new office 5 days a week. And we really took it into account as to how we put all these services into place. So we do have a teen advisory council, and we take a lot of their input in what they want, our marketing, our day-to-day, our programming, our swag, that's what we give out. We really take that into consideration and put it forward. As adults, I think we feel we know what the teens may want, or what is best for them, but I think hearing it from the teens themselves and then implementing is what's going to continue to bring in our teens and then actually then utilize our program moving forward as well. I'll go ahead and put my contact information down in the chat if you all have need to reach out for any questions. Again, I'll go ahead and send out my slides over to Kelly so that she can send those out as well if needed. But again, we are here to support our teens who are 9th through 12th grade. We're open 7 days a week, Monday through Friday, 1 to 8, Saturday and Sunday from 10 to 6. And then we are completely free. I will say we are closed for the upcoming holidays coming up. However, we will then provide them with other resources if we get them.
Adrian, thank you so much. That was fantastic. It was so great to know about new resources that
Anyone
are in our
have any
community.
questions?
If there are any questions for Adrian, please feel free to unmute or type them in the chat. Can
Well,
everyone hear
thank
me
you
okay?
all for listening.
Oh,
I'll be sure
okay.
to pass everything on so that you all have my contact information as well.
Okay. I think it might be Adrian's sound. Hopefully you can hear me, Adrian. Thank you so much for taking the time. I do have your slides and I will make sure I share them next week with the group so you can have that information. And I'll also put some of those graphics into next month's slide deck so everyone can see those graphics and have that information on that walk-in facility, which is so great. It's fantastic. If there are any questions for Adrian, please feel to put them in the chat. He's going to put his contact information in the chat. Otherwise, we can move on. I know he's having a little bit of tech, so he may have had to hop off again, but we can reach out to him at a later time. But in the meantime, I just would like to welcome Colleen Harvey, who's the Executive Director of Playworks Illinois. She is going to come on to speak to us about Playworks. Hi, Colleen. Thank you for joining. I am going to share my screen and pull up your presentation. Give me just 1 second.
No problem. Hello, everyone. How you doing? Hopefully, happy Friday. We've almost
Happy
made
Friday. Almost.
it. Awesome. All right. I'm Colleen Harvey. I'm the Executive Director for Playworks Illinois, and we are a super proud partner of the Cook County Department of Public Health. And so we wanted to be able to share some resources and some ideas on, we know some of the conversation has been happening around behavior concerns in schools, right? Student concerns, and really we wanted to offer a perspective on how play can really support that, how play can support mental health. So if we go to the next slide, which we actually don't need this second slide, just so you know, Kelly, we can probably pull it down briefly. We're going to play a little bit of game, a little game. We like to call it I Love My Neighbor, especially my neighbor who. Now, if you're feeling excited and ready to move around a little, feel free to come on screen so we can see you in your video. If that's not possible for you, that's okay. You're going to be able to participate in a different way. And so the way this game works is I'm going to go ahead. I'm waiting to make sure we can see anyone that's there.
I see Desiree and Madonna. Can you see them?
Yes, I'm seeing double of myself. I'm wondering if that's.
You may have shared the team screen, which is why you see double. So
Oh.
I'm sharing your presentation, so you don't need to share.
Oh, perfect. Yeah, I was just saying
Okay.
we can put that down. Okay. All right. So the name of the game is I Love My Neighbor, especially my neighbor who. And the goal is certainly to, when, we're playing it in person, to get up, move around, really kind of, engage in different ways. Here's the way we're going to do it here. If you are able to come on camera, you are welcome to stand up, touch a wall that's closest to you, and come back to your seat as soon as you can. If something is said that's true for you. If you're not able to come on camera, then what you can do is you're going to want to pull up the React for your chat and give us a heart. So for example, I'm going to say my name. It's Colleen. My pronouns are she, her. I love my neighbor, especially my neighbor who loves fall. So if you love fall, go ahead and stand up, find a close wall, come right back to your seat. If you love fall and you can't come on camera, go ahead and give me a heart reaction. Ooh, I'm seeing some hearts. I'm seeing some hearts. There we go. Yeah, feel free to throw them in the chat too. Awesome. All right. So I didn't see who came last, right? For example, that's part of the way we do that. But let's go ahead. I'm going to pass it to Nell. If you're brave enough to either come off mute and share something that you love, that's true for you, to see if we also love it.
Can you hear me?
Yes.
Wait, I'm sorry. So I'm supposed to say something that I love, correct?
Yeah, I love my neighbor, especially who, and then anything that's true for you, and we'll see if it's also true for us.
I love my neighbor, especially if they are morning people.
Ooh, that's a good one. Morning people, go ahead and throw a heart in the chat or touch the nearest wall. I'm gonna stay. I'm more of a night owl. And I'm gonna be looking to see who's one of our last folks to either come back to their seat or to put a heart in the chat. And I can't really see it that well. I'm not sure if it's just my view, but I will say, Nell, do you want to go ahead and pick someone to go next?
Sure. Let's see. Jackie?
Go for it, Jackie.
If Jackie's not available, I'll go. This
Oh,
is Kaylee. I love my neighbor, especially if they love chocolate. I picked the right one.
That is a really good one. Yes. Yes. I see some hearts now. There we go. Thank you so much, Kelly. You want to pass it to one more person? We'll do our final round.
Sure. What about Alda?
Go for it, Alda.
Okay, I would have done chocolate as well. I love my neighbor, especially if they love holiday movies.
That is such a good one. Thanks for sharing. I love seeing the hearts. Personally, I like to start my holiday movies next weekend over Thanksgiving weekend, so it seems very timely.
Me
Nice.
too. I like to wait. I don't want to get tired of them.
Exactly. Same with the music. I like to give myself a little time. Oh my gosh. Well, thank you so much, everybody, for playing. Again, that game is called I Love My Neighbor. So we're going to just really briefly, I'd love to hear your thoughts. You can either put it in the chat or you can come off mute. But what do you think were some skills that, of course, us as adults would get during playing that game, or what kids would get when playing that game? What's an example of a skill or something they would practice?
Listening skills.
Absolutely. Listening. When we do it with kids in person, we're typically in a big circle and people are moving to try to get to someone else's spot in the circle. And so they definitely want to make sure they're listening to see if it's close. Ooh, I love that. Thank you, Marley. Empathy. Absolutely. Relating to others. It's such a fun, sneaky way for kids to be able to share something because we know there's lots of folks, lots of kids and youth that really like to share about themselves, but also then make those connections to the larger group. Yes, absolutely. Community building. It's a really good example. How might this create a bigger sense of inclusion or belonging? If you want to speak, anyone want to speak to that?
I'll step back if anyone has anything to say, but otherwise I'll jump in. It allows them to find out who has similar interests as themselves, so they find something they're belonging to. Thank you, Kelvin. I couldn't get my words out.
Yeah, I love that. And one thing we like to talk about with kids or youth that play this game too is like, you're able to share something that maybe, again, someone wouldn't necessarily know, right? It doesn't have to be something visible. Maybe it's not part of your visible identity, but it's something that you feel, and again, that we're creating a space of trust and that kids are able to share that. So thank you all for playing. We can go ahead and put that third slide up. All right, so I'm kind of going to go pretty quickly. I know there's a good amount of slides we have because, I use the kind of context around this deck and what we talk about as none of this is new to you all, right? It's not a surprise. However, it does help set the foundation and really create shared understanding around the environment in which we're in, right? And so we all know, right? Children's health and well-being is at a greater risk now than any other time. And I'm not going to go through all these, but certainly you can see a specific whole host of different concerns. I'll just pull out one, right? The 1 in 3 experience bullying at school, and that's super concerning for us. That's something we're really actively working against. And just, right, yeah, like the 40% of children having feelings of sadness or hopelessness. Unfortunately, that is the reality, and we know it's only been compounded post-pandemic. So we go to the next slide. we know also, right, that we're seeing kids playing 50% less than their parents did during their childhood, and how that kind of precipitous decline is leading to so many kind of either negative outcomes or missed opportunities. And so we're thinking a lot about the ways to kind of help bring those opportunities back in. So we'll go to the next slide. And again, I know we've all been very well versed in this, but just also kind of underscoring that we know, right, low-income children of color play even less and have less access, right? Safe outdoor spaces, certainly we see that in our work at Playworks. The disparities, unfortunately, in the variety of different spaces that kids use for play, resources to be able to participate in extracurricular activities, right? Pay to play, different leagues and different things. And unfortunately also that we know kids who really need recess the most. Again, we all do. We all need, opportunities for play and physical activity throughout the day, but that unfortunately often they get it the least amount of time throughout the day. So if we go to the next slide, we know what matters, right? We want to make it really clear the connection to strong social emotional skills and how play really fosters that. We know that when kids have an opportunity to develop those skills, even early on, right, they're 54% more likely to earn a high school diploma, much more likely to attain their college degree, much more likely to have a full-time job by 25. And then, of course, the negative impacts, the negative outcomes are listed here too, right? So we know that those are, of course, all very connected. So if we go to the next slide, we just want to highlight that we believe every child, needs to play every day, and we want to help create the spaces and foster opportunities to do that. Talks about our mission, right? Improve the health and well-being of children, increasing opportunities for physical activity and safe, meaningful play, our core values, and some of the ways that we do that. And so you'll be able to get this slide deck afterward, and there are links within it to be able to see some of the videos. So we'll go to the next slide. So we partner with a lot of different groups, right? We partner with schools, with districts, with agencies, of course, with out-of-school time organizations, specific local community-based organizations and foundations, to really increase those opportunities for safe, meaningful play. We think about that, a couple key elements that are included in the way that we do that, right? We do classroom learning time, right? We focus on the specific lessons and really kind of diving deeper into social emotional learning supports. We think about recess engagement for the facilitators or the adults that work at recess at our schools, thinking about the ways that students develop skills for self-regulation, conflict resolution, of course. Those are some of the biggest ones that we work on during that time of the day. And then we also do our youth leadership program. We call that junior coaches. Typically, they're older elementary students, 4th, 5th, maybe 3rd, maybe 6th grade, depending on the way it works at a school. It's application-based, but it really gives kids a sense of ownership within the school community and really helping give them the opportunity to learn with their Playworks coach or staff coach throughout the year, and then actually come out to recess and help lead games and activities and facilitate and resolve conflicts and, encourage a really positive, inclusive community. So if we go to the next slide. So here's just a couple other things you can see. We are really grateful to have done a lot of different studies and have a lot of evaluations. And we know, right? We know based on when we are partnering with a school or an organization that we see increased student attendance, certainly more opportunities for emotional and physical safety with students, a lot more positive peer and adult interactions. We'll talk a lot about the adult piece, academic engagement, right, teaching time, and then vigorous physical activity. And then, of course, we also see the chronic absenteeism going down. We see physical and verbal conflicts going down. We see discipline incidents and bullying just continuing to decline when the school and when the organization we're partnering with is really focused on the kind of holistic culture and climate that we work on. So how it works. There's a couple resources here. This is our theory of change, right? We really just kind of think about the inputs, of course. Those are those arrows on the left side, the Playworks best practices, engaged adults, and dedicated partners, and how they really, again, all three of them have to exist in a way to create and support what happens after that. They help foster those safe and healthy play practices, and you can see a little bit of a description of what that looks like, which then leads to kind of really building out the safe and healthy play spaces, and then, of course, going even broader into the larger community. And so that is generally the way that we approach our work. So continuing on with those best practices, I wanted to offer you all, especially knowing the way that, there's a lot of different folks on the call that interact with schools. And one of the things we talk a lot about at Playworks is just the way that recess can make or break a kid's day, right? And how much of an opportunity it is to really encourage and ensure that the kids are really invested in the rest of their school day. So we use this kind of graphic to help, again, visualize, right, what a great recess can look like. We see the triangle as some of the core elements of what are needed to make it happen, right? We know that games, some type of activity is often super critical, right, to be able to have that as part of your recess or part of your even playtime, whatever that looks like at your school or organization. Staff, of course, huge important part we'll talk a little bit more about. And then the systems, which I think is often the most forgotten about, right? You need to have clear systems, of course, right? They're all wrapped around with the communication, right? We need those things to all be in really clear communication with each other, to have everyone on the same page, and to have a level of accountability so that people know who's going to be doing what, when they're going to be doing it, where throughout the building, right? And then the other piece I'll say is the kind of lead up, right, to get to that top of the pyramid or the triangle, is this idea around, and we've done a lot of work around the Great Recess framework, this idea that any great recess, it's always going to have student and adult safety, engagement, and empowerment. And we've developed out a tool that's really critical. Again, we call it the Great Recess framework, and has a variety of different indicators and kind of factors that we look for in assessing how a recess is doing. So if we go to the next slide, it digs a bit deeper on just some examples of the ways when we partner with a school of some of the questions we ask and think about and help build out the kind of design for what they'd like their recess to look like. So is there a leader? And if so, who is that person? Full-time, part-time? Are they able to have space throughout their day to prepare for recess, to have it be a time that's really invested in? Does the whole team, right? Does the whole group of adults that works at recess, are they able to meet regularly? Are they able to connect and talk about the challenges they're seeing and the successes they're seeing and ways to help prevent conflicts or issues that come up for the next week or the next month, right? Are there any incentives, right, to use during recess? How do we help carry over? One of the things when schools bring us in, and we see a lot of the times they're having a challenge in that they have kind of school-based behavioral systems that work really well in the classrooms, but then there isn't a tie or a specific connection to the outside the classroom time, right? The lunchroom, the recess time, before and after school. And so we really help bridge those gaps. Of course, play equipment, right? What are the recess goals, the vision, and are there rules, procedures, and relevant consequences in place, right? We really try to make sure that all of those things are set and communicated ahead of time. So if we go to the next slide, this is another just resource I wanted to offer for all of you, again, in a variety of different roles that you may have. One way to think about how impactful adults are during that time of day. And it just gives you some visuals, right? We use the language of Recess Rockstar, of course, to kind of get to the ultimate, proactive, really engaged adult team member. But you can see the span. It starts, of course, with maybe a disengaged adult, someone that maybe hasn't received a lot of support or training, or is distracted, or has not been made clear of what their expectations are at recess, right? There's a whole host of reasons why that may happen, but certainly we see that can be a challenge during that time. Then we kind of see a moderately engaged adult, and there's some other examples of what that can look like. An engaged adult, of course, with some great examples of what you want to see, and then going above and beyond, right? That Recess Rockstar really. And again, none of this, I think, is a surprise. It's really just hopefully helping for all of you to connect the dots of the more that we see the adults that are at recess building relationships and really having a positive rapport with students, the more impactful and the more productive and really just successful recess and that time of the day is. We see more positive reinforcement, right? We see more role modeling. We see adults that are, again, more proactively engaging with the different activities, have really strategic movement. That's a really big one we talk a lot about. So those are just some good things to kind of keep in mind, and perhaps a resource to share with your teams at your schools. Another resource I wanted to highlight, just a digital service. We have a whole host of resources I'll follow up as well that are on our website. This one as well, it's called Keep Playing. It's basically a 38-week subscription service where you have an email come to you each week if you're signed up, and you get essentially a game of the week and a social emotional focus that ties into that game, and a variety of different ways to modify the game or activity, some additional resources around the SEL skill that you're working on, as well as a brain break. So even just an additional kind of really short in the classroom, get up and moving, or any space that you're in. And so there's a sample you can check out, but there's a few more as well that you can see on our website that hopefully are helpful when thinking about, using play as a support for really, I would say helping to restore students' mental health, right? That's certainly a really big piece of what we've been seeing in our partner schools. And I think we're getting toward the end. Yep, I just want to highlight one or two more things about the partners and engaged adults. So again, kind of like that earlier slide we went through, here's just another couple examples of very specific things that we help kind of uplift with our partners and think about. It is really important that everybody in a school building is on the same page around what recess can look like and what their role is with it, and what support they can offer or even go to if they need it. And so those are just some more examples that might be helpful that you might want to pass along or engage with if you're seeing recess on a regular basis at your school. And yeah, all kids deserve joy, of course. So I definitely wanted to make sure to save some time at the end. This is the end of our presentation. And is there any questions or anything that we can help out with?
Me stop sharing. Thank you so much, Colleen. That was fantastic. I think someone is asking a question. Go ahead. I thought I heard something. Maybe it was some feedback.
Maybe not. I can certainly, I'll monitor the chat and respond there if anyone has a question, but thank you all so much. Really appreciate it. And go play this weekend. Take some time out. We all need play.
It's a great reminder as adults, we need this too. And a lot of these tips you shared, we can use ourselves. Like, I don't know if Marley is still on, but these are great things that we could use in like our staff meetings or anything like that. We need brain breaks as well. So I will definitely be
I
checking
agree.
out. Yeah.
I
I'll
agree. I
definitely be
love
checking
this.
out your tips. Yeah,
Oh,
it's great. If we have time, I can play that video if there aren't any questions. Did you want to do that, Colleen?
Sure. I'm not sure if there's other pieces on the agenda, but you're welcome to.
No, you are it. If there are no other questions for any of our presenters, we can play Colleen's video and we can see some of the kids in action if you'd like that. I'll give it another minute or so if anyone wants to unmute and ask a question. Otherwise, I will mute myself and then pull up that slide. Thanks.
Play can help kids get moving, improve mental health, and help kids practice critical social and emotional skills while having fun. Playworks has over 25 years of experience leveraging the power of play to bring out the best in every kid. And we're so excited to partner with you to ensure kids experience the benefits of play. Together, we'll ensure that kids have equitable access to Playworks' favorite games that can be played on-site, online, or offline. Keep Playing features Playworks' favorite games and brain break activities curated for you. Designed with easy modifications for age ranges, virtual experiences, and more. Each week, you'll see the academic and social emotional learning applications to match that week's activities. To get the most of Keep Playing, we recommend remembering weekly that you are an adult who cares. CARES. C, check your email. We'll send you a weekly email that highlights your new game of the week and a link to the platform where you can access additional resources, like a weekly brain break activity and game modifications for different age groups. A, access your additional weekly content by logging into the platform using your unique login. R, review the game and find the modifications that are appropriate for the kids you impact. E, engage and play with kids. and start conversations using the weekly prompts. S. Share the game and SEL skill of the week with school staff or family members to play, practice, and reinforce it with kids. If you want additional games to try, tips, or tools, check out playworks.org/play-at-home or the Playworks online game library. And if you're looking for more support, Playworks can help. Email info@playworks.org and we'll connect you with someone who can work with you to identify which Playworks service might work best for you.
That is great, Colleen. I really love the organizations, and I appreciate everyone, and thank you for taking the time out to come on to share. It was so great to learn about that, and it's inspiring. We can take those tips to learn as adults too, to have brain breaks and play in addition to getting our work done, so we can embrace that child within that sometimes we, have set aside. So that is so great. If there are no questions for Adrian or Colleen or Denise, then we will adjourn our meeting until next month, December 17th. I'm sorry, December 15th, where we will continue our conversation, and we will have a representative from Loyola Hospital to talk about the Stop the Bleed program, and we'll have some other resources for you all. So as I've stated before, our School Health Advisory Council has told us about some of the needs and the resources that the school would like. So we're trying to embrace those needs, such as SEL information. So we're going to continue to try to take those needs from those suggestions and bring them to you every month. So we will see you next month on December 15th. Thank you to Marley. Thank you to Denise, Adrian, and Colleen. And thank you all for your partnership and support. Happy Thanksgiving. Don't eat too much. Well, eat plenty. Enjoy yourself. Get outside. Enjoy yourself. The temperature is supposed to drop by next week, so enjoy it while you can. The light show is tomorrow downtown, so have a great weekend, and we will see you all later. And thank you, Alda, for the recommendation. They were fantastic. We will see you all next time. Enjoy. Bye. Thank you.
Thank you.